Something we've talked about earlier this weekend is dizziness. And we all know that the body needs three input for balance: the vestibular system, the visual system, and the somatosensory system. And if you start taking those away piece by piece, you can find out what the patient is suffering from. So if they have the room is constantly spinning, or they're spinning inside the room, or if it's just when they're in a certain position in bed, these are all different signs and symptoms of different conditions. Whether it's BPPV, a type of vertigo, or it's dizziness, or it's just a cerebellar or canalith issue, where it's the inner ear. And you can do tests for these. You should have questionnaires to help to address what type of symptoms they're actually having, when they're having them. Could it be coffee related? Is it just when they're turning over in bed or looking up into a cabinet? Is it when they first stand up in the morning? All these things kind of give you indications as to what to test for. So once you start testing, you can start taking away each of those necessary systems one by one. You can have the patient stand there and close their eyes. And if they start falling, then you've taken away the visual system, and now you're stuck with the vestibular and somatosensory, which means that it narrows it down to those two, kind of, doesn't it? If you have them on some type of wobble pad, or you take away kind of the stability of the feet, you take away the somatosensory or feedback from the joints, because now there's not as much give to it. That leaves you with the vestibular system. So you can take a look at the different positions of the inner ear that actually address where we are in space and time as we turn in motion, up, down, sideways, lateral movement. And we can address that by putting the patient into those positions that aggravate it and make it worse. We can find out if it's cerebellar that way. And we can do different things to treat it. I treat dizziness all the time. We have patients that come in, and when they stand up, they wobble back and forth, and we put a certain treatment on one side of the body or next to the ear, or we use a warm caloric, or we might use warm water or cold water in the ear to test if it's the cerebellar or vestibular system. We might do an Epley's or Dix-Hallpike type maneuver. These are all the ones that we've seen involving positioning of the head. Sometimes diet related. Sometimes they're frying their system with too much inflammation. Sometimes it's a gluten intolerance, and there's blood tests, CBCs, stool samples, sensitivity testing you can do for gluten, soy, casein, egg, yeast, and you can find out if they're sensitive to these things. And we run those on patients sometimes because we want to make sure we get to the root cause. Because as you know, as we've said 100 times, is we treat patients neurologically and metabolically. It just makes sense that we should address the entire system, that we should take a look at the brain, the neuroendocrine axis, and the endocrine system itself. The nervous system is for short-term, fast activation and response of the body, and the endocrine system is for long-term. So if you have a chemical that flows through the body, it's not a second-by-second basis, as opposed to the nervous system where if I step on a rock and I lose my balance, or I stand up real quick and the room starts to feel shaky, that's second by second. So we look at the patient and we use functional neurology and functional endocrinology. So it's the nervous system and the endocrine system. And it just makes sense, doesn't it?